So there are 3 phase 3 studies for CLL here with Ibrutinib, which is just remarkable. Up until today, there was just 1 phase 3 study in the frontline setting for newly diagnosed patients. That was the Resonate-2 trial, where we saw a survival benefit. Now we have the ECOG 1912 data, comparing Ibrutinib rituximab versus really the gold standard for those young patients less than 70. And what we saw is we saw a significant improvement in progression-free survival and a significant improvement in overall survival. That's truly remarkable. So now we have 2 studies that have shown survival regardless of age, ECOG 1912 and the Resonate-2 trial. And on top of that, we also have the Alliance study and the Illuminate study. And the Alliance study looks at Ibrutinib or Ibrutinib rituximab versus BR, which is just a commonly used chemotherapy around the world for these elderly patients. And we saw a significant improvement in progression-free survival. And also in the Illuminate study, looking at Ibrutinib plus obinutuzumab versus chlorambucil obinutuzumab, which is an NCCN Category 1 recommended therapy, we saw significant improvement in progression-free survival. So it's really, you really have the overwhelming amount of evidence now with 4 phase 3 studies really showing that using Ibrutinib is extending survival for these patients, regardless of age, regardless of the biology. I think it's going to really give patients that opportunity to live longer. I think they're going to be able to avoid chemotherapy. When we think about the advances we've made in 5 years, think about the progression-free survival that we see in these patients. We probably have a progression-free survival in these newly diagnosed patients with Ibrutinib of probably 7, 8 years. If we think about the advances in science that's going to happen over the next 5 to 10 years, I think we can really move away from chemotherapy and look to fundamentally change the outcomes for these patients.